Hello, good afternoon everyone, and welcome to the Enabling Positive Lives for Autistic Adults webinar. We'll introduce ourselves in a minute. There's three of us here. The session should last for about an hour, and you should be able to see the slides that we've already got. The slides and the recording will be available in a week's time, I understand. And also, it's important to note that we are looking at a screen where we can see questions that people ask. So please feel free to put some more questions up. We'll try and answer them as we go along, but there may be periods of 5 minutes or so where we talk to the slides and then take a bit of a break to answer questions. So to give an overview of this session, the webinar will cover the national picture, how the Department of Health and Social Care, NICE and BASWA work together to support social work practice around autism. The British Association of Social Work's capability statement for social work with autistic adults and how it links to NICE guidance. Working closely with autistic adults to ensure that support meets their needs. Developing good relationships with autistic adults and understanding how best to communicate with individuals, and the particular challenges that affect autistic people, and putting personalised and specialist support in place to help them overcome these challenges. So we'll be starting from kind of a national overview point of view and then moving into specific detail as each presenter goes through their slides. Okay, so to introduce myself, my name's Trevor Wright. I was diagnosed at the grand old age of 56, having spent several years kind of wondering, oh, is this me, is this me? But I'm also a self-advocate on the Department of Health Autism Executive Board and a co-chair of that board, as well as a local authority commissioner. So second on the panel today is Godfred.
Hello everyone, thank you very much for joining us at this webinar. My name is Dr. Godfred Bowerhen. I am the Policy and Research Officer for the British Association for Social Workers. I'm a qualified social worker. Most of my social work practice experience has been with disabled children, and my PhD research was on integrated learning disability services, which also involved working with autistic adults.
Good afternoon, my name is Hayley Davis. I'm also a qualified social worker. I've worked with Kent County Council for 4 years, the last 2 of those working in sensory and autism services, specifically the sub-team of specialist autism services.
Thank you, Godfred and Hayley. Just to remind people that there are 2 main NICE guidance on autism, guidance papers. The first one, CG 142, which is around autism spectrum disorder in adults, diagnosis and management, and QS 51, which is the quality standard. And those are the 2 main NICE guidelines documents on autism. So, to begin the first few slides around the national picture, some people will know that the Autism Act was passed in November 2009, came into force January 2010. And the Autism Act is unique in that it's the only actually statutory act of Parliament for a lifelong condition. So the Autism Act in 2009 covered 18s and over only, so it wasn't meant to encompass children. It was followed by the first kind of supporting guidance document, Fulfilling and Rewarding Lives, in 2012, and then by a much more substantive document called Think Autism, which came out around the same time as the CARE Act in 2014. And then a hefty piece of additional statutory autism guidance came out from the Department of Health in 2015. So if people are looking, if people have not seen documents before but are looking to read documents on the current position, then Think Autism 2014 and Statutory Autism Guidance 2015 will be the two places to go. Now, in the Act, there is a requirement for the government to review and revise the strategy in 2019, and I'll get on to what that's involved and where it's leading to in a couple of slides later. But the main thing to note is there will be a new strategy, vision and implementation plan published nationally in England, this is, in spring 2020. So moving on to the next slide. 10 years after the Autism Act, there's a number of pieces of evidence that kind of indicate how far we've travelled in the last 10 years since the Act. One important thing to note is that the NHS long-term plan that was published in January 2019 does prioritise autism, and that's people with learning disability and autism, and autistic people who don't have a learning disability. And there are priorities around diagnosis for children, for example, transforming care cohorts and bringing down waiting lists. And NHS England have expanded their specialist autism team. The two major pieces of evidence that will inform the new strategy are the Autism Self-Assessment Framework outcomes from 2016 and 2018. And the self-assessment framework is a set of 140 questions that get sent for local authorities to compile, but not just on local authority services. It's about the support to autistic people in their area, so encompassing health and voluntary sector and culture and leisure. So I think that's the 5th iteration of the Autism SAF, as it's called, since the first one in 2012. So there's a lot of evidence there about progress in localities. Last year, 2019, both National Autistic Society and Department of Health made a call for evidence, and there was over 15,000 responses to that call for evidence from autistic people, carers and professionals. I think that's the biggest response that National Autistic Society have ever had. At the same time, there was an all-party parliamentary group who looked at 7 main areas, and each area was led by an individual MP. Those areas were public understanding of autism, supporting adulthood, health, mental health, transition to adulthood, employment and access to justice. And those findings, together from National Autistic Society, Department of Health and the all-party parliamentary group, were published in the Pearce Foundation report, The Autism Act 10 Years On, to which there is a link in later slides. Just to bring things together on the forthcoming strategy, the Department of Health and Social Care held a large stakeholder workshop back in October 2019, where self-advocates, carers, parents and all the professionals from different sections of health and social care, plus all the national charities, and the Department for Education, DWP, Transport, all the main government departments, came together to start to look at the evidence that come out of the SAF and the APPG report, and start to actually prioritise what should be in the forthcoming strategy. As I said, that strategy will be published in spring 2020. There's no firm date yet, but it will encompass material from the current SEND and mental health reviews and the government work on disability strategy. And the important thing to note is that the new strategy for 2020 to 2025 will be all ages. So the first time it will be people under 18. Moving on to the next slide, that just outlines the 7 areas that I mentioned a few minutes ago that the All-Party Parliamentary Group on Autism concentrated on. So for those who are interested in what might be in the new strategy when it gets published later this year, those 7 areas and that APPG report, I think, are a good grounding in what the challenges are. And in each area there are a set of recommendations that, fingers crossed, the new strategy will pick up on and devise an implementation plan around. Just to highlight a couple of the main findings from the APPG report. Over 2/3 of autistic adults told us that they were not getting the support that they needed, and that could mean as many as 327,000 autistic adults across England. There are other stats there, and there are many more actually in the report itself, but the picture that was painted indicated that 10 years after the Act, there are still, whilst there are some areas of good practice, there are still a lot of areas that need development and further implementation across England. To move on to the revised national strategy, the 2 documents that I referred to earlier from 2014-15 were over 18s in the main. The statutory guidance and Think Autism did start to provide some detail around transitions or preparing for adulthood, so it started to kind of move into the territory of under 18s. But the important difference is that the 2020-25 strategy will be all ages. The Think Autism was based upon 15 I statements. I want to feel safe in my community, for example. The new strategy will differ in that it will concentrate on a set of core outcomes for individuals. The existing strategy has had 31 core actions and 5 task and finish groups that were responsible for both developing and implementing and monitoring how those 31 core actions had been implemented across the country, and that was backed up by the evidence from the Autism Self-Assessment Frameworks. In the new strategy there'll be a much more concise implementation plan. So for each area of development, such as access to criminal justice, there will be a clear implementation plan. The old strategy was monitored by a National Autism Strategy Board. We think that will carry through into the new strategy, but with an expansion out to include representatives from Department of Education, more parent representatives, and if we can, children's representative, autistic children on that board. So the governance structure will probably expand and probably change a bit in the way it operates from spring onwards.
Trevor, one of our listeners has asked what I think is a really important question, and I wonder whether you have any thoughts on this, which is, would the national strategy be UK-wide, or would it just refer to England?
Okay, yeah, thank you. The strategy as it stands will be for England, because I don't believe Wales has actually got legislation. Whilst it has a strategy, I don't think it has legislation. And I think the situation in Scotland and Northern Ireland is also different. So initially it will be England only, but I know that Department of Health and Department for Education are making links with those other Northern Ireland, Scotland and Wales Assembly Government to make sure that there is some kind of correlation across the different strategies.
Right.
And thank you for the question. The strategy, when it comes out in spring, will be supported by a set of tools. There has been a Health Education England competency framework for learning disabilities for a couple of years now. That was supplemented by the publication of a competency framework from Health Education England in October 2019, which covered the competencies for autism for health staff. Godfred will talk about the competencies for social work later. But there was also the Department of Health and therefore the government's response to the consultation that took place last year about mandatory training. And the good news that I think was published November the 5th or 7th last year, which you can see online, was that there are moves to make autism training and learning disability training mandatory for health and social care staff. At the moment, I don't think that includes education, which is a bit of a lack of fit, that given that the strategy will be all ages. But I think the education side is still under discussion. As part of that move towards mandatory training, there is a sum of about 1.4 million, I think, that will be available. First of all, to agree standard content for mandatory training, and then to test out that standard content in both health and social care spheres. So most of 2020-21 will be that kind of piloting, testing out before the mandatory training gets launched more towards 2021. Allied to those two tools that are on the slide, there are two more worth mentioning. There will be a Commissioner's Guide to Autism published at the moment provisionally in April, and that will contain three things. It will contain details of how best to commission for autism, some graphs, some detail about what commissioners should be commissioned, what would be right across the kind of pathway from pre-diagnosis to living well with autism in the long term, but also a prevalence calculator that localities can use to identify needs in their local area. And as I said, that's expected in April this year. And then Research into Practice will be publishing a guide again in April called Autism Inclusive Practice, which is aimed at social care staff. So not only will the strategy come out with new demands, but there'll be some supporting tools there for health and social care workers to use as well. The next slide, which is entitled Good Life for Autistic People, is an ongoing piece of work. So this is a draft. And this is the bit that I've just referred to that takes what is it that autistic people may need. And it's important to note that every autistic person won't need all of this or may need different bits of this at different times in their lives. But what is it that autistic people and their families may need right from the point of pre-diagnosis, through diagnostic and assessment, through specialist assessment and support, onto living a good life in the long term in the community. So just to pick out a few things, advice and information obviously being public available when somebody first thinks, you know, am I possibly autistic, or a family maybe may think that. When you're on the waiting list for a diagnosis, an assessment for presenting needs. So a lot of autistic people have either average levels of anxiety. Ideally, that should be kind of assessed and dealt with before somebody gets the actual autistic diagnosis. Why do you have to wait for the piece of paper for things like access to IAP, for example? And then at the point of diagnosis, an important one is ensuring access for sensory assessment, particularly that sensory assessment is so connected to behaviour and what people call challenging behaviour. And then in the long term, things like having a strength and weaknesses analysis and some statement of what your differences are and what your strengths as an autistic person are. So that diagram, as I said, a piece of work that's still in development. There is a background document that will be published online by Skills for Care when the commissioning guidance is published in April. So I think that's me finished in terms of my slides, and move on to Godfred.
Trevor, many thanks, and another warm good afternoon to our audience. My name is Godfred, and I will be talking about the BASWA, British Association of Social Workers, capability statement for social work with autistic adults, and how this relates to the National Institute of Care and Health Excellence guidelines on autism and also working with autistic adults. I want to start by highlighting that the BASWA capability statement is built on the professional capabilities framework, which, as most of our listeners who are social workers would know, is really a practice framework for all social workers working with people of all groups of people who use services, and also in all settings. And so the capability statement builds on the PCF, Professional Capabilities Framework, and is divided in 3 main sections. One section, the first section, is titled Purpose, and it really explains the values, ethics, the rights and equalities that social workers should be aspiring to and focusing on in their work with autistic adults. Then the second section is on the knowledge, skills and critical reflection that is required to make a positive difference for autistic adults. And then the third section is about how social workers can exercise leadership and professionalism within the organizational context of their employment to really make a positive change for autistic adults. It is worth highlighting that the capability statement is one form of knowledge that social workers draw upon in their everyday engagement with autistic adults. Trevor has already mentioned the Autism Act. There is, of course, the Care Act and statutory guidance, which, as social workers will know, are the foundational documents that we ought to refer to, because they really highlight our legal responsibilities, coming through local authorities, and also the rights that people are entitled to. Alongside these 2 pieces of legislation is the knowledge and skills statement for social work with adults in general, and then the capability statement builds on that and it focuses much more on the needs of specific group of adults, i.e. autistic adults, and how social workers should engage with them. And then the NICE guidelines are also drawn upon. And then, last but not least, it's important to highlight that there are other sources of knowledge as well, such as research knowledge. We shouldn't also forget that there will be local policies and procedures, for instance, procedures around interagency arrangements that social workers ought to know about. And then, importantly, social workers' own practice wisdom, and also their informal knowledge about the local areas that they work with. And they draw upon all these sources of knowledge in their work with autistic adults. What the capability statement for social work with autistic adults does, though, is that it seeks to integrate all these forms of knowledge, and therefore seeks to serve as a one-stop shop, if you like, for practice guidance on what social workers should do in their work with autistic adults. So let's try and sort of broaden this out and paint a picture about the situation of autistic adults in society in England. The latest prevalence studies suggest that 1.1% of the population in the UK may be autistic. This is from the Office of National Statistics in 2007. That's over a decade ago, so the situation might have changed since then. Nevertheless, most diagnosis of people is between 4 and 7 years old, and there are increasing rates of diagnosis of autism in the community. However, it is important for us to focus on the fact that for every 3 adults diagnosed with autism, there are 2 who are not diagnosed. So the rate of diagnosis, although increasing, is still not where we really want it to be. And as I will come to explain later on, diagnosis can unlock services for people, and also diagnosis can unlock other medical services that autistic adults will need. Then moving through the statistics quickly, 500,000 autists. There are 500,000 autistic adults in England. This is according to Department of Health statistics. 70% of autistic adults say that they do not get the services that they require, and I think this goes back to an earlier slide that Trevor showed. And only 16% of autistic adults are in full-time employment. So already as social workers, we're starting to unpick some of the stigmatization and also some of the denial of services that some autistic adults experience in their community. So what are the key social work issues for us then? I think as social workers who work with autistic adults, we need to start thinking about how people identify themselves and how people want to be referred to. The accepted terminology now is autistic adults. Nevertheless, some people who may show signs of autism still resist the diagnosis or category of autism and may wish to be referred in terms of neurodiversity. What we then need to ask ourselves as social workers is, how do we work with people who resist categorization when in most areas that we all work in, the diagnosis of autism might be one of the criteria for people to be eligible for services? And in answering that question, we then need to fall back on the Care Act, which really enjoins us, pushes us to focus on thinking about people's needs rather than their categories or their diagnosis. And as we all would know, the Care Act focuses on the need for personalized strengths-based assessments, thinking about the strengths that autistic adults have rather than what they're not able to do, because sometimes these can be important foundations for us to build really creative and strengths-based assessments that really truly empower people. The Care Act also pushes us to think about the knowledge base of the assessor, because it stipulates that assessments should always be conducted by assessors who have knowledge, and that then brings into play the NICE guidelines which explain autism and also how to sort of engage with people around diagnosis and so forth. And just to finish on this slide on the Care Act, assessments have to be within multi-agency context, and I think this is hugely important. Thinking about social workers needing to understand autism, and sometimes our health colleagues might have more knowledge about the medical implications of or ramifications of autism than we would as social workers have. It is therefore important to work in that sort of multi-agency context at all times, also focusing on the needs of a person within their family context, thinking about how diagnosis and also services, and any assessments will impact on their family context.
Oh, Godfrey, an interesting question has just come up. How can we improve the family approach, knowing that we often see children and parents both with a diagnosis? Now, I know I can talk about that a bit later on. Did you want to touch upon that?
Do you want to start then, Hayley? Start on that, and I have some thoughts on it.
Well, I mean, I will cover some of it in my slides later on, but I know that a lot of the time when we go out to do our assessments, and we complete our assessments with clients and quite often with family present, that's a great opportunity for us to also explore assessing eligible needs of parents as well. So not only looking at the availability of carers assessments, but also linking with third-party organisations, National Autistic Society. It's not only about supporting our clients, it's making sure that family members, whether in the household or providing support from further away, also have the skills and knowledge to support our clients equally. What do you think?
I think that's a wonderful response, and what I would say to this is that question highlights why social workers ought to know about autism, and also why social workers need to start thinking about their role much more, if you like, at the less pronounced level of need, because we encounter people in our daily interactions, we visit family. Therefore, if we know about autism, then we're in a position to signpost people into the right services. And therefore, the social work role in identifying and also diagnosis of autism is really, really crucial. Trevor, did you have any thoughts on that?
Just to reinforce the same thing, really, given that autism is thought to be in families, might not travel vertically along the kind of family tree, in that it doesn't go necessarily from parent to child. It can go from kind of grandparent, uncle, back to child and under a different line. But it's something that's really important. After I was diagnosed, we did think about my daughter, even though some of the professionals involved didn't make that connection. And then I am aware of many people who've had children diagnosed, and ideally, although you can't make assumptions, it is useful to think about the parents. There may be an undiagnosed parent there, and there may be an undiagnosed, for those people that work in older people's services, there may be an undiagnosed grandparent or great uncle who are in their 70s, 80s, may not even know that they're autistic, but still struggling at later stages in life with a lot of difficulties.
And I think, Trevor, that point, referring to grandparents and parents, I think really highlights the last point on the slide on the right-hand side about taking a whole family approach. I think if we really practice within that whole family approach framework, we then have to start thinking beyond necessarily adult and children's services, and really thinking that actually I may be an adult social worker, but actually it's important that I know about the legislation that pertains to children's services and vice versa. So moving on then, I think this next slide expands further on the previous discussion about the need for us social workers to think that we have a role in diagnosis and signposting people to diagnosis services. However, we do need to bear in mind that there is a tension here between the medical and social models here, because some autistic adults may not wish to be categorized or diagnosed in inverted commas. However, diagnosis, as we've been saying, can unlock services. Diagnosis also might lead to uncovering other co-occurring conditions that might exist with autism. And diagnosis might also be the key to statutory services in some areas. So there's a tension there that we need to bear in mind. And I think we need to think really creatively beyond saying, wow, this person is refusing diagnosis, therefore, I don't know what I can do with them. We really need to think creatively about how we engage adults who may not want to be diagnosed, but nevertheless have needs. And so I think this slide really sums the discussion about diagnosis and social work knowledge neatly. This is from the American literature, but I think it really also pertains and applies to the situation in England or the UK, in that it's saying social workers ought to have knowledge about specific assessments and understandings of what types of assessments are used for diagnosing, because then we're in a position to support people by providing emotional and therapeutic support. And this is why the NICE guidelines are really important, because they talk about these diagnoses and the sort of medical positions. Because of time, I will not be able to go through all these slides, but I do know that the slides will be available in a week's time, so I'm hoping that our listeners will be able to refer to them at a period which is convenient for them. What I do want to do, though, is conclude on these last two slides by starting to think about how, as professionals, we should think about the various forms of knowledge that I discussed at the start of my presentation. How do we integrate the PCF, the knowledge and skill statements, the NICE guidelines, and the capability statements? Well, my suggestions and my advice would be this. The professional capabilities framework is really the foundational practice framework. Obviously, we do need to think about the Social Work England regulatory standards. That's the minimum threshold that social workers should meet to be able to practice, to be eligible to practice. But building on from the PCF is the knowledge and skill statement, which then refers specifically to adults, and then the capability statements build again on the KSS and refer specifically again to autistic adults, and then the NICE guidelines would then refer to particular needs or particular domains of work with autistic adults. So here is a checklist that I have devised, which I think would be helpful for us to think about how we draw on these practice frameworks. The starting position would be, well, what is the knowledge? What is the legislation that applies here? What are people's rights, and what is the statutory guidance? This has to be the starting position, and we know about the Care Act and the statutory guidance, the Autism Act, the Mental Capacity Act, and the Mental Health Act. Then the second question we ask ourselves is, okay, what practice framework applies to the specific group of people that we are working with? And that really applies to the capability statement for autistic adults, or the capability statement for adults with learning disability. And then moving along that continuum, we ask ourselves, what particular guidance applies to the specific piece of work that I'm doing with this specific group of people who need these specific services? So it may be that we're thinking of assessments or diagnosis. The NICE guidelines are helpful there. We may be thinking about the needs of a young person in transition. The NICE guidelines are helpful there because there's one referring to under 19-year-olds. Or we might be working with autistic adults whose behaviors our services are struggling to manage. Again, there's guidelines there which we can refer to guide us through our thinking and our work in that specific area of work. So I will now hand over to Hayley, but Trevor has a question.
If it's okay, Hayley, can I do 3 quick replies
Absolutely.
to some questions? First one, I think, is Mariah, who asked about mental health services and 18s to 25s, whether the strategy will cover that. It will cover mental health and autism, but I think the question, if I've read it right, is probably around service models, and that probably will be left to localities to work out amongst yourselves across health and social care. Kirsty asked about Wales, Shemai Kirsty, whether there was a separate strategy. Yes, I think there is for Wales, but I think the Welsh Assembly government decided not to make it statutory. So there is a strategy, but not an Autism Act in Wales, as far as I understand. And then Sylvia asked about whether the strategy will come in after or before the mandatory training. The strategy will be spring this year. The mandatory training will be tested in 2021, and therefore will come in later than the strategy itself. So I hope I've answered some quick questions. And there's some fascinating comments and questions coming up. Hayley.
Just quickly on that point, I can see there's a lot of questions around social work practice and assessment. I'm hoping to cover quite a lot of these in my slides, which is why I haven't highlighted them just yet, but obviously if I do miss anything, please let me know. So, my name is Hayley Davis. I'm a practicing social worker in an autism specialist team with Kent County Council. Oh, we'd hope if I moved on to the next slide. There we go. So to start off with, we're going to talk about identifying care and support needs. And we start this by completing a Social Care Act assessment, which is built upon the criteria and eligibility determined by multiple pieces of legislation, but most obviously the Care Act 2014. We cover a range of subjects in our assessment, including personal care, access in the community, additional diagnoses, mobility, family networks, which is covered by Care Act assessments, or should be covered regardless of which team we're talking about, whether that's older persons, whether that's mental health. However, as an autism specialist team, we also ensure that we cover more specific areas, such as, exploring if there's any identified sensory needs, for example. And just to comment about the eligibility criteria, obviously a benefit of our current eligibility criteria is that it supports our use of a strength-based approach throughout our assessments, because we can recognise a client's ability to complete a task independently while still registering it as an eligible need. For example, if completing that task independently causes a high level of stress or anxiety, we can recognise the strength and the skills in completing that task independently, whilst also registering the need for support. So working with people to meet their needs. As a specialist team, we're very lucky in as much as we can offer quite creative and flexible methods of completing assessments with our clients. And sometimes other teams might not be able to offer that flexibility and creativity. And by that I mean, we don't have to complete a social care assessment in a person's home one-to-one just with them if that's not how they're comfortable. We can be quite creative with location, as long as we're conscious of, kind of discussing confidential matters. And we don't have to complete it in one go. That can be quite overwhelming to ask all these personal questions. It's a very intense environment. We've got the luxury of being able to offer several appointments to complete that social care assessment. What's important to us as a specialist team is that we take into consideration the specialist needs and knowledge that we have, and we apply that to completing the assessment to make sure we really get a good picture of our clients' strengths, what they're finding difficult, and how we can support those needs in a most person-centered way. We also have the ability to develop trust with our clients prior to assessment. So unfortunately, as a lot of social services, we do have a waiting list. In an ideal world we wouldn't, but unfortunately we do. But whilst clients are on our waiting list, that provides us an opportunity to develop rapport, to build confidence. We can get to learn our clients' communication needs and how they most prefer to communicate with us. And whilst on our waiting list, clients can approach our duty team for specialist information and guidance. And so can their family as well. We do give that number to everyone, and including other professionals. So we really look at building that trust and that rapport from day one. And then to go on to talk about personalised plan. So having used our strengths-based social care assessment, we will take that assessment back out to visit our clients and their families to make sure we fully understood everything that was discussed, because obviously a lot gets talked about in those assessments. We want to really make sure we've got it right. So once we've had the opportunity to review that assessment and everyone involved is happy that we've got an accurate picture of needs, we then create a personalised care and support plan. And the way I sometimes describe this to clients is it's almost a bit like a to-do list. We really formally set out what tasks are we going to complete, who's responsible, and we set very clear deadlines for completing those tasks, just for absolute transparency.
And Hayley, there's a question here which I think it's so important in talking about assessments and the principles underpinning that. And I wonder whether you have some thoughts on this. And this is from JJ saying, what happens when the principles in assessments that have to be adhered to, have to be followed? For instance, strengths-based, person-centered co-production and co-creation are not being applied by frontline support workers. And for support workers, read also social workers and other professionals.
I think that's right, and I know we touched upon it in our previous slides. That's where training and mandatory training is so important. As a specialist organisation, we do offer a lot of information and guidance to families, to support agencies, to support homes, whether that's supported living or residential. But I also think that's where the training and the information and guidance available from National Autistic Society, BASWA, NICE, that all comes into play. And that's where I sometimes think organisations need to take that responsibility for making sure their support workers have had that training, especially if we're talking about, say, for example, a support agency. If they are accepting support packages for our clients, we're looking to check, have they had that specialist training, because it is so important for providing that person-centred approach.
Yeah, and Hayley, I think that's a really important point. And I guess another point to add to that is, by implication, anti-oppressive practice means challenging where plans, practice, and approaches are not consistent with social work values, or are not really in line with what the law or practice or statutory guidance stipulates. So I think it can sometimes be an uncomfortable position to find yourself in as a social worker or the other professional who has to challenge the approach of other professionals. But we all know from many serious case reviews and many service reviews that actually sometimes other professionals notice more practice and don't feel confident enough or don't actually know the mechanisms, the channels by which they can challenge those practices that they feel are below the desired standards. Absolutely. So that's what I would add to that.
No, that's a brilliant question. So just to finish off about care and support plans, and I saw an earlier comment about, with electronics being used more and more, actually care and support plans aren't readily available. Certainly within Kent County Council, we're still very focused on providing paper care and support plans, and also multiple copies, so families there's full transparency, families can see exactly what we've agreed to work on, but also we still maintain that we need to be able to provide these care and support plans in different communication styles, so whether that's with pictorial aids, whether that's in an easy read format, we still need to be able to have that adaptability to our care and support plans. So moving on to, that leads quite nicely into language. It's important to avoid jargon, and I think that applies to all social work practice regardless of who you're working with. Jargon does not make for person-centred practice, and it alienates to an extent our clients from engaging with the assessment. Obviously, and the important use of terminology, at the moment, in making sure that we're using the correct terminology of autistic person, autistic adults. And not only that, but it's about not being assumptive with our terminology. Quite often during our assessments, clients may wish to discuss sensory overload, but clients should have all different sorts of terminology for that, whether some might refer to it as a meltdown, some may refer to it as sensory overload. and their clients really feel like you're listening to them if you mirror that terminology, whatever they're comfortable with, whatever they identify with. And not only that, I think gender terminology is really important to mention here as well. So, you know, the use of correct pronouns. A lot of clients who we're currently working with are transgender, gender fluid, part of the LGBTQ+ community. So it's about making sure that we're using the pronouns that they're comfortable with, but also addressing them by names of their choice, just because the name they've completed their registration with, or their referral form, sorry, actually during the assessment they may wish to be named differently. So that, again, that's all really important to being person-centred. And having our knowledge that we do of kind of specialist autism, we allow additional time for language and communication. We can offer longer visits. We can split our visits up into multiple visits if short information is processed easier. We can send out paperwork in advance. We can send out follow-up paperwork afterwards. Any adaptations we can make to make sure that clients are able to process that information. So, moving on. Support from others. So liaising with local specialist autism services, well, in our case that is us. So we are very lucky that we can provide that information to other services. So many clients have dual diagnoses, whether that's mental health, physical health, whatever that might be. So it's so important that the other teams within Kent County Council are aware of us and know how to approach us for specialist information. Clients who, for example, autism might not be their primary need, it may be their mental health, it may be a physical disability, doesn't mean that we can't still come out and support with that assessment or provide information and guidance during the time they're open to social services. So it's really important that we're liaising with all teams within social services. And just looking at systems theory, obviously that's a major social work theory that we should be implementing in practice. Looking at who's supporting our clients, what family support network is there, what friendship support network is there, and what support do they need in their own right, whether that's, obviously I know we touched upon it earlier in our comment, is that a carer's assessment, is that liaising with other organisations, do they need a care act assessment in their own right, taking all of these things into consideration, and working closely with the resources that we have. So tailored support. In the next slide, I'm going to talk kind of more specifically around the specialist interventions that we can offer. So just to summarise that, basically what I've already touched upon, that everything is incorporated into our care and support plans, and we have the luxury of being able to consider creative and flexible ways to meet those needs. So I think I'd probably like to allocate more time to this next slide. So, I mean, coming from Kent County Council, I can only talk about what's available to our specialist autism services, and I'm aware that obviously every county is very different in what they can offer. Where we have our specialist autism team, I think that's encouraged a multidisciplinary approach to supporting autistic adults. So just to touch upon some different areas of support that we offer, looking at structured leisure activities, including individual and group exercises. We're very lucky to have organisations within Kent, for example, Advocacy for All. They're a self-run social support group for autistic adults, which is a great resource for us to refer to, because a lot of our clients' social support groups cause a high level of anxiety. So actually going into an environment where you are going to be supported, you are going to be understood, that can be a really great first step in reducing some of that isolation and social inclusions that clients might have by the time we get around to supporting them. Life and employment skills. We're very lucky to have two key organisations I'm going to mention here. The first is Kent Supported Employment, which is an organisation which supports adults with additional needs. So that's not only autism, that's a variety of additional diagnoses. They work really closely with employers to provide additional training. A lot of clients that I've worked with, having employment gives such a sense of achievement, and it provides routine, and it's that independence that comes with all of that. But working with an employer who doesn't fully understand your needs can just be, well, heartbreaking, I should imagine. So we're very lucky that we can refer to Kent Supported Employment, because they can provide that additional level of support to make that employment successful. And in terms of life skills, we have an enablement service, which is an extremely scarce resource, sadly. But it kind of does what it says on the tin. It enables our clients to develop their independent skills, to give them new coping strategies, to give them skills and adaptations and aids that help them to complete those daily living skills that they want to be able to live completely independently. And it's an absolutely brilliant resource, and sadly it's extremely scarce. Supporting with parenting. Now, I know we talked a little bit about carers assessments, but I think it's also important to pick up here the joint work we do with children's services. So whether that's under child protection plans, child in need, or early help, whatever the case may be, ensuring that the information being provided to parents by those services is in an autism-friendly manner, ensuring that the meetings are autism friendly, whether that's not overloading in massive amounts of information, or ensuring that the handouts are in a particular format. Because like my colleagues here on the panel picked up on previously, it's not just our clients that may have a diagnosis, we're also looking at mum and dad, grandparents, aunties and uncles. So that's where there's a real importance on adult services and children's services joining up together to make sure that that support is being provided in the correct manner. To move on to anti-victimisation support, I saw a comment previously about advocacy. I can't spot it now, I think it's gone up the list. So Kent has advocacy services that we readily and frequently refer to for all manner of reasons. There's not also about making clients aware of advocates that are available, but also as social workers, to going out doing that frontline work, making sure that we're promoting awareness of different forms of victimisation and befriending, really increasing our clients' knowledge and making them more aware of potentially dangerous situations, and giving them skills and techniques on how to handle those situations. We've worked quite closely with police also on kind of workshops around befriending. A big issue in Kent, particularly at the moment, is around cuckooing. So we've done a lot of work with Kent Police on providing autism specialist information and guidance, because that's a real issue that we're trying to tackle at the moment. Social opportunities. I know we've talked about kind of autism social groups like Advocacy for All. In Kent, the National Autistic Society has gaming sessions, has youth hubs, has support hubs, which are all brilliant resources for us to refer to. But we also look at other methods for social opportunities. Some of our clients don't feel confident yet going out into the community and accessing resources for the first time. So actually, can we look at putting in a support package to meet, that's an identified social care need, can we put in a support package to meet that need? Can we put in a direct payment for a really specific day service that client feels confident attending? It's all about, we have these resources, we have the legislative support of the Care Act, so let's be creative and flexible with how we implement that support. And then to move on to anger management and challenge and behaviour programmes. Anger management is something that at the moment we're accessing mostly through general practitioners, but we're lucky in as much as we have providers who provide things like, for example, cognitive behavioural therapies. And a theme we've noticed in Kent is sometimes cognitive behavioural therapies on offer aren't autism friendly. Sometimes they're very focused around specific mental health conditions, and that cuts off a lot of our clients from being able to access that service. So we're very lucky that we can offer autism specific CBTs. And finally, just to mention, we also have a service called CAMCAS, which is Kent and Medway Complex Autism Service. And this is where we're now starting to pull in that multidisciplinary approach, because CAMCAS includes psychology, OT, SALT. So for us as practitioners to have a direct link to that provision is extremely beneficial for our clients, because it's really starting to pull in that focus on the multidisciplinary approach. So that is my slides covered, and I'll hand back over to my colleagues.
Thank you so much, Hayley. We are now coming to the end of the webinar, so we're concluding, and we just want to highlight that there's the there's the NICE guidelines and also the Basel capability statement, which can be referred to and are available online. I just want to conclude by summing up that this afternoon we've been talking about social work practice with autistic adults. We've started from giving a broad overview of the national policy and legislative context, and then have moved on to talk more specifically about practice issues, namely how social workers can draw upon the Basel capability statements, which provides a one-stop holistic overview about social work practice with autistic adults. And we've related that to the NICE guidelines and have shown that that provides much more specific detail about specific domains of work with autistic adults, such as, for example, assessments and also diagnosis, and also thinking about commissioning services. And then Hayley has spoken powerfully about her direct line practice experience, drawing on her experiences at Kent. What Hayley's presentation reminds us of, though, is as social workers, we ought to think beyond social care, to think about the multiple services that people with that autistic adults need to live a fulfilling lives. I just want to finish by just passing to my colleagues here to say the final word before we conclude. So, Trevor?
Thanks, Godfred. There were a couple of questions on the legislative background to the mandatory training, which I haven't got time to answer. But if you go back to the link on slide 10, the right to be heard, the government's response to the consultation on mandatory training, then the legislative route and what they intend to do in 2021 is in that document. Secondly, on language, as Hayley was saying, you can just Google and get a YouTube video called 10 Things Not to Say to an Autistic Person, which is really helpful. It's quite gentle. It's a bit of a laugh, but it's got some good things to take note of. And last point from me really is around, there are lots of differences that autistic people have, but we have a lot of strengths. So asset-based approaches, please.
Hayley?
I think that covers everything I was going to comment as well. Thank you very much.
Fantastic. Thank you so much for being such an engaging, lively audience. And we hope that the webinar has been of benefit to your practice and you can draw on the learning from this in your work with autistic adults. Many thanks and have a good afternoon.
Thank you.